As we find ourselves in the midst of the holiday season, a time that can be both joyous and stressful, it's important to take a moment to reflect on our mental health. With the new year on the horizon and the winter months setting in, it's not uncommon to experience feelings of sadness or overwhelm. Today, I'm joined by Dr. Christine Palmay, a family doctor from Midtown Toronto, who is here on behalf of Care to Know to help us navigate the complexities of mental health and provide us with valuable insights on how to prioritize our mental well-being during this very busy and stressful time of year. Welcome back to the show, Christine.
Thanks for having me.
So I honestly can already feel people because those bills are going to start rolling in soon. And not to mention all the other stress, oftentimes just even with your own family. So can we talk about the importance of prioritizing our mental health right now?
Psychological stress, physical stress, social stress, you mentioned financial as well. I think it's really important to step back and realize that those stresses can take a toll. And the pressure to be joyful during a supposedly joyous season also is another stress. I certainly see a complete increase in my patients with mental health disorders coming in and saying, I'm really down. I feel like I shouldn't. So there's a lot of self-shame. And certainly, in Canada, mental health resources are so difficult to access and are also expensive. Self-care and self-awareness and doing what you can to increase your mental health is so essential.
And, I think we hear it a lot, but because sometimes it is difficult to assess if somebody is depressed or if they're having a hard time because we mask it well. So what are some of the common signs and symptoms of depression? And if for people who are observing these things and perhaps friends and family, what should we be looking for?
Fatigue that's unexplained. I mean, obviously low mood, emotional dysregulation. And what that means, crying, happy, not understanding why your emotions are as such, not wanting to do the things. So this is the big one, not wanting to do the things that you used to do. If you loved walking and just don't feel like doing it anymore, you can the list is endless. I think some of the signs are quite subtle and it takes a bit of introspection. And you can imagine during the busy holiday season, we don't have a moment to breathe. And so take that time, do a mental health checklist. How am I doing today type of thing.
And how do anxiety and depression interact?
Such a difficult question. And number one, they often occur together. I, have a few patients that are only depressed, a few patients that are only anxious, but usually they occur in conjunction. The question is are you more depressed or more anxious? Anxiety, is a sense of panic. Oftentimes there's more agitation involved. I often say my patients worry and then worry about worrying. It's sometimes difficult to differentiate, but if you have that jittery sense, that unsettled sense, that probably puts you along the anxiety scale. But as I said, it's a spectrum and they usually happen together.
And I don't think, especially since, everything went south in 2020, it's fair to say that a lot of us have anxiety. We're on this nonstop, roller coaster with news and events around the world. So you can't blame people.
We were put in a perpetual state of panic and being scared of what was forthcoming because of the uncertainty. And we know that, chronic stress can set up its own type of circuits. And there's brain circuits that happen in feedback, and those need to be addressed. And absolutely, Candace, post-pandemic, let's not even talk about it during the plague, but post-plague, I have many patients who never had any anxiety or depression who've come out and said, I don't think I'm doing well. And I'd like to have a conversation about that. The problem is that we don't have many resources in the medical care system. So, I oftentimes focus on DIY supports, making sure eating well, you're getting outdoor activity, etc., but also seeking information that's credible about your condition and accessing resources that are credible. I always say that nothing is, there's one thing that's worse than no therapy, and that's bad therapy. It's a plenty with the misinformation out there.
And this is such a complex and multifaceted issue. So how can Canadians educate themselves and stay informed about mental health conditions and all of the available treatments out there?
So number one, if you have a primary care provider, access them right away. Have a discussion about how you're feeling. We have scales. There are some supports. You can be put on a wait list. I certainly offer patients a lot of resources meditation, breathing exercises, etc. Look at your lifestyle. I always say the basics. Look at your diet. Look at your exercise. Look at your sleep cycle. But in terms of resources, be very careful because this is a field that that people are very vulnerable, and a lot of people realize that and will take advantage of that vulnerability. So a lot of the lotions and potions out there, I always say I don't have any desire to peddle snake oil. So credible sites, mental health organizations, and we talk quite a bit here about caretoknow.ca. And the reason I like this site is number one, it's updated, the information is ever expanding, and it is medically supported in the sense that we have medical experts like myself that are providing input to what's available and what's not available and updating regularly. The medicine is evolving every day and information should evolve accordingly, and you need to know where to go. The internet is here to stay, but browsing safely is so important for so many reasons, right? Misinformation can be devastating, and a wrong turn can lead patients down rabbit holes, especially with mental health, when people are just wanting help. And that pure desire, like I said, makes them vulnerable to nonsense available. So caretoknow.ca.
All right. And this is such a deep issue that you have expanded on this in a longer blog post on whatshesaidtalk.com. So I encourage people to take a few minutes for themselves, go read it. If not for you, for somebody in your circle, this is really important. And let's take care of each other because this is a stressful time for everybody. So thank you so much for joining me, Christine.
Thank you so much.